My name is Dr. Sugandha Gupta and I'm a consulting psychiatrist at Delhi Mind Clinic, Karol Bagh, New Delhi. Today I'm going to talk to all of you about the impact of COVID-19 pandemic on the mental health of everyone. So as this COVID-19 pandemic, which started way back in 2019, continues to wreak havoc on the physical health of people across countries throughout the major half of 2020, it has also brought forth an avalanche of mental health issues. If the sudden stringent lockdown imposed unforeseen challenges for people across all ages and professions, so did the lifting up of the lockdown, as people found it very challenging to navigate their way through the raging pandemic, keeping themselves safe and then also managing their day-to-day life around it. As new social and financial challenges came up, people being trapped away from their hometowns, elderly parents left alone, competitive exams cancelled with careers lying in the lurch, businesses failing and jobs being lost, there were also many direct triggers of this COVID-19 pandemic on the mental health of individuals. Amongst these, the most important one is the fear of contracting a mysterious, life-threatening illness. Never seen before, never heard before. It is enough to give everyone sleepless nights and palpitations. So, in the last few months, we have had many patients reaching out to seek psychiatric help and psychological support with some mental health issues. Talking about them would raise awareness in helping everyone identify if certain symptoms like these are present in us, our loved ones, and seeking help early would also help in a quick recovery. So, in the last few months, the first most important symptom and the most common symptom that people have presented to us with is anxiety. It's come forth in many forms. Acute onset, short lasting, palpitations, racing of the heart, trembling, breathlessness, choking, fear of the unknown has been the most common complaint. It has come across all genders, all ages, all professions, right from young college going students to homemaker women to businessmen to elderly people. Besides this, fear of contracting COVID-19 and keeping themselves and their loved ones safe has also led to an increase in rigid cleaning behaviors and excessive avoidance behaviors. So many people have presented with complaints of avoiding going out, severe restrictions in touching anything, fruits, vegetables, packed food items which have come from outside, excessive and rigid cleaning of doorknobs, TV remotes, currency notes, etc. and also spending excessive time in hand washing, cleaning, bathing and all. Most of such patients have responded well to a short course of medication and or some counseling support. Other group of patients that has presented to us has been of the depressive nature. So initially the prolonged lockdown, the severe restrictions, the weakening of the social support system, disruptions of the daily routines, so on and so forth, brought together many people who presented with sadness of mood, feeling less energetic, less motivated about studies, about work, even about their daily routines, crying spells, hopelessness and so on. These were not just businessmen whose businesses were going down or had failed. There were also students who had lost their friends around. There was no routine, no college life, and even homemaker women were left worrying about their welfare, their children, their family, and so on. Many of these patients again responded well to medication and counseling support. Besides these, other complaints were insomnia, very commonly. A disruption of the day-night schedule has constantly brought forward people with insomnia. Increased use of smoking, alcohol and other drugs to help allay one's anxiety has led to a rise in the addictive problems as well. Many people have also presented with a rise in their headaches, tension headaches, migraines, IBS-like symptoms have also worsened. And not just these, many colleagues, physicians have reached out stating that contributing anxiety and depression has also destabilized patients of diabetes and hypertension who have started to show gross fluctuations in their BP levels and their sugar levels because of the underlying anxiety. So all in all, the last few months have been challenging for everybody. Besides the new social challenges, financial challenges, the COVID-19 pandemic illness itself has been very frightening, and because it is an unseen, unheard thing before, people are experiencing all this the first time in their lives, they find little support, little comfort in the world around them. Add to it the constant media portrayal of the daily rise in numbers, the daily rise in deaths, the treatments, the vaccines, so on and so forth has also led to an aggravation. So I would recommend to pay a little more attention to yourself and your loved ones around you, and if you find anybody manifesting with the symptoms that we have talked about today, please seek professional help at the earliest. Hopefully the pandemic should go away soon. Until then, take care and stay safe. Thank you.